Welcome to my video series on C. diff or Clostridioides difficile infections. This is part 2 in the series, and today we are going to discuss who is at risk for getting C. diff infection and how you can help prevent that from happening. In part 1, we talked about the clinical syndrome of C. diff infection and also discussed C. diff in the environment and how some people are asymptomatically colonized, meaning they have it in their intestines, but they are not actually having an infection due to it, especially infants. So today let's talk about who is at risk of actually getting the infectious diarrhea. I'm Dr. Katrina Coulter. I'm an infectious disease doctor, and I make educational health videos with a focus on the microbiome. And if ever there was a disease that highlighted the importance of having a healthy microbiome, C. diff is that disease. So let's jump into that. Just a friendly reminder that this is for health information purposes only and not to be taken as medical advice. So let's get right into who is at risk for getting C. diff diarrhea. C. diff diarrhea is most likely caused by taking a systemic antibiotic. When you take an antibiotic systemically, meaning you either take it orally or intravenously, not a topical, a systemic antibiotic, your risk of developing C. diff infection goes up 8 to 10-fold. That is because antibiotics disrupt the normal microflora or microbiome. And your most protective mechanism against getting C. diff is by having a richly diverse, healthy microbiome. So anything that really disrupts this is going to put you at risk for getting it. So antibiotics systemically, 8 to 10-fold risk. This is just a plug that anytime you take an antibiotic, just pause and question, is this truly a bacterial infection that will not be resolved any other way? We often use antibiotics for prevention just in case so that you don't get an infection, and this may actually have a very negative result of you developing an infectious diarrhea that can be relapsing and recurrent and very difficult to get rid of. So there are a few other risk factors, and they all have to do with disruptions in the microbiome. So as I run through these, I want you to kind of think about how this would affect the microbiome. The first is simply age. So being over the age of 65 increases your risk 5 times of getting C. diff. And the most likely reason is because as we get older, our microbiomes become less diverse. Having that rich, diverse microbiome helps outcompete the C. diff. It uses up natural resources that the C. diff needs to survive. And it also makes protective metabolites that help prevent the C. diff. This is especially true in women after menopause because, as it turns out, estrogen plays a big role in the diversity of the microbiome. Another thing that tends to happen as we age is that we get a little bit more sedentary, and movement itself also increases the diversity and richness of the microbiome. So age greater than 65 is a risk factor. Having an inflammatory bowel disease such as ulcerative colitis or Crohn's disease is a risk factor. And this is likely because there are already disruptions or dysbiosis of the microbiome happening that are leading to the pathology of this disease. Unfortunately, this subset of patients also is more likely to have a very severe outcome when they do get C. diff and more likely to need a colectomy, which is a removal of part of the large intestine. So this is a group that really needs to focus on maintaining that normal microbiome or having practices that help to promote a healthy microbiome. The next group kind of fits in with that, and these are people that have had a gastrointestinal or an abdominal surgery. Often these surgeries are preceded by a prep so that we can kind of empty out the colon before the surgery to make the surgery safe, and this really disrupts the microbiome, as well as you get some perioperative antibiotics with it. Other groups that we find at risk are those that are undergoing treatment for malignancies such as cancer, and a lot of these treatments are very hard on the intestinal tract. Also, patients that have had a solid organ transplant because they are on immunosuppressive medications, and patients that have had a bone marrow transplant are at increased risk, but really only for the first 100 days. And that's likely because there is pretty heavy prophylactic antibiotic use in this population for the first 100 days. Patients that have chronic kidney disease or end-stage kidney disease, end-stage renal disease, also are at an increased risk of developing C. diff colitis. If you've taken a course of antibiotics, your risk, as I mentioned, is 8 to 10-fold higher, and then this lasts for about 4 weeks after you take the antibiotic. At 2 months after the antibiotic, your risk is still 3 times higher than that of the general population. If you end up in a hospital, your colonization rate, which in the normal population is about 2 to 3%, goes up very rapidly. So in the first day of hospitalization, your colonization rate could be 20 to 30%. And if you've been in the hospital for 30 days or more, you have a 50% likelihood of being colonized. This is because C. diff has spores that live on hospital surfaces, and we're going to talk about that here in just a moment. So now you've heard all these groups that have an increased risk, and maybe you are familiar with them or it kind of hits home and you feel like you're at increased risk. How can you prevent it? The main takeaway of this video is that the most protective step against getting C. diff colitis is having a normal, healthy microbiome. That is the most protective thing that you can do. So really nourishing your microbiome now before you need a course of antibiotics is paying it forward to prevent this infection down the road. And if you've watched any of my other videos, you know I talk about this in almost all of them, and I'll link a few here that you can go and review to learn ways to protect and nourish and have that richly diverse microbiome. The second thing is hand hygiene. So let's talk about those spores. The C. diff bacteria makes a vegetative spore. This is a dormant state that the bacteria is in. These spores are very resilient and robust. They are hard to kill, and they can last for months on surfaces. So they can live on surfaces like countertops, toilet seats, doorknobs, light switches, telephones, and clinic items. So they're likely all over the healthcare setting. Now, these spores in this state are dormant, but once they get into your intestinal tract, they can become vegetative, and then you have C. diff. Hand hygiene is crucial to eradicating these spores. Alcohol-based hand sanitizers do not kill the spores. The spores are removed from your hands by good old soap and water hand washing. And it's the actual physical act of washing your hands that gets rid of the spores. So hand sanitizers do not work. It is really important if you are a caretaker of somebody with C. diff or you yourself has had C. diff that you practice soap and water hand hygiene. So that is our second best preventative step, is by being incredibly diligent about hand hygiene. If they're on your hands, you can ingest them and then they can get into your GI tract. Once they get into your GI tract, something called a bile acid helps to activate these spores. Your primary bile acids specifically activate them. Bile acids are something made by your liver, and they're part of our normal functioning. They help us recycle our hormones, they help us digest our fatty foods. And that plays an important role when we look at certain diets that may predispose you or may protect you from getting C. diff. So most of these studies have been done in mice, but here's what we found. Mice that eat a high-fat diet have higher amounts of primary bile acids in their intestine because they're producing more of this bile in response to the fatty diet. So that may predispose someone to being more likely to develop C. diff. Again, this is done in mice. They're a little bit different than us, especially in their gastrointestinal tract, but it's a lot easier to control a diet in a mouse than it is in a human. We've also found that mice that have low fiber diets tend to have a more likelihood to develop C. diff infection and a more severe disease. Mice that are on low protein diets actually tend to recover from the disease a little bit better. They don't have as severe of a disease and they have a faster recovery time. And then when we gave mice high fiber diets, that seemed to be protective against getting the C. diff infection. So to recap, high fat diet may put you at more risk. Higher protein diet may put you at more risk for severe disease. Low protein, high fiber diets seem to be the most protective, and those mice recovered more quickly. So they specifically looked at something that we refer to as prebiotics. Now, reminder, prebiotics are the food that your probiotics eat. Your probiotics are the beneficial bacteria in your colon. So the prebiotics are the non-digestible carbohydrates that make it all the way to the large intestine, and then these are fermented there by the beneficial bacteria into something called a short-chain fatty acid. Again, I'll link some videos where I go into this a little bit more for you to review. So we found that when we specifically feed mice prebiotic fiber, or they're also called microbiota accessible carbohydrates, or MACs, that these mice tended to be more protected from getting C. diff. And in particular, the prebiotic fiber that was consumed by the probiotics, or the good bacteria that produce the short chain fatty acid called butyrate, were the most protective. Okay, cool. We'll all just take a butyrate supplement and none of us will get C. diff. Amazing. Unfortunately, this is incorrect. This does not work because butyrate is actually pretty nuanced. Too much butyrate will cause those C. diff spores to germinate and may promote toxin production in the C. diff. So it's very interesting because we do have studies that show that humans that get recurrent C. diff have low levels of these butyrate producing bacteria, but supplementing with butyrate is not protective. It turns out we just need to nourish the bacteria that actually make the butyrate, and we nourish them by feeding them the food they like or the correct prebiotics. You can take prebiotics as a supplement, but you can also get it in your diet as dietary fiber, and this is going to give you the most benefit. So I recommend trying to find the dietary fibers that are a prebiotic for your butyrate producing bacteria, because like everything that happens in the intestine, it's a complex biological interaction, and it's more than just the butyrate. It's likely something else that these bacteria are also producing that are inhibiting the C. diff. Other things that are considerations: probiotic supplements. This has been something that has been debated now for many years, is whether or not probiotics are helpful in preventing C. diff colitis. And unfortunately, the data is not great. So what I mean by that is the studies are all over the place. The amount of probiotic that is used, the strains that are used, the other dietary factors are not controlled. And so we don't have strong, convincing data that probiotics are helpful. When you do a meta-analysis and you pool all the studies together, it does suggest that there might be a slight benefit by taking a probiotic supplement. I encourage my patients to eat probiotic foods and make sure they're getting plenty of those prebiotics, because the probiotics are no good if they don't have any prebiotic fiber to feed them. Another class of medications that has been looked at as potentially being causative of C. diff or contributing to it is something called a proton pump inhibitor, or a PPI. These are available as prescription, but also available over the counter with names like pantoprazole or omeprazole, or commonly known as like Protonix or Nexium. A lot of people take these medications, and it is controversial as to whether or not this makes you more susceptible to C. diff. Some studies show that there is a slight increase in your likelihood of developing it, while other studies show that there's no difference in people that take them versus don't take them. When you kind of zoom out and look at the big picture, these medications suppress the acid in your stomach, and the acid in your stomach will alter the flora in your microbiome. And again, acid is produced naturally, and so often we will suppress acid-loving bacteria by taking an antacid or an acid-blocking medication. So while it's not really known whether these may put you at risk or not, I do encourage you, if you're on a PPI, to maybe question, do you still have the condition for which you originally started this medication? And is it something that you could potentially stop and let your microbiome kind of go back to its wild type state? So there we have it. We've discussed who's at risk and ways to prevent C. diff with having a normal, healthy, richly diverse microbiome as being the main way to prevent C. diff, and really good hand hygiene with soap and water as also being a way to prevent it. In our next video, we're going to talk about diagnosis and treatment. So please like or subscribe this video, share it with somebody that needs it, and I'll see you on part 3.